Okay. So let's talk about a little bit of anatomy here. So when we are out of alignment, there is a misalignment, meaning that bone is meant to move. It twists, it turns, it flexes, right? It rotates. Those are normal motions of how that vertebral column works. And then there are things called the facets, and that's that joint that allows those bones to communicate and work against each other. Then you've got muscles and ligaments and tendons and all of that all working through here, right? And so that's what holds us and stabilizes us. But when we come out of alignment, that subluxation, that misalignment of that spine, it is directly translated to less than a dislocation. So as we compare the adjustment, which is a low velocity, high amplitude thrust to a specific area versus a football injury or a car crash type injury, it's just not that same amount of force. So it would be a far stretch to compare an adjustment to getting tackled by a 300-pound man. It's not the same thing. What we use is the lever of those bones, which allow us to move those bones. But the thing is that these small misalignments within the spine causing pressure on that nerve leading to symptoms can be affected not by a push. It uses the levers of those bones. We don't just push on that spine to create the proper motion. We're using contact points within that bone, knowing the direction of the bone, knowing the angles of that facet to know how we can move that spine. It is not so grossly and dramatic and painful as being tackled by a lineman.